to the cloud. Sir, this is Lokesh Idara from IRCF. So what we're doing is we're requesting the so much good work the neonatal resuscitation program FGM first golden minute did in India, and because the need is we have 25 million babies born compared to 4.2 million in EU and 2.5 million in USA. And our tasks and challenges are very, very big. But what I learned from our website a little bit is it was done since 2006, and government and Indian Academy of Pediatrics, our neonatal National Association, all together came together doing wonderful job. We included all the states across the country, all the associations geographically helping. So we wanted to, I wanted to land, and so does the European Union Resuscitation Council members will share this video to them. So because nowadays with the, they can able to take their own time, watch what is your work and India work. So that way they can able to help IRS Indian Resuscitation Council Federation application to the ILCOR. That's why, sir, go ahead, sir, just start. So I will be asking as we questions.
Yes. So the neonatal resuscitation program is currently training is done by two major organizations in India, the National Neonatology Forum and the Indian Academy of Pediatrics. The National Neonatology Forum began doing trainings since about, I think, 1987 or 1989. But because the membership of that organization was relatively low and it was restricted to mainly people working in the newborn area, the numbers of trainings that happened in a year were relatively low. In 2007, the president of Indian Academy of Pediatrics, Dr. Naveen Thakkar, had interactions with colleagues in the international arena, with in China and with people in the US, etc., where he came across this Helping Babies Breathe program, and that was being launched, or that was being in preparation. And he came back and discussed these ideas with leaders in Indian Academy of Pediatrics. So somewhere in 2008, they decided that we will launch the neonatal resuscitation program through the Indian Academy of Pediatrics. And they had a big launch in 2009, January, in Bangalore during the regular national meeting of Indian Academy of Pediatrics, which is called the Pedicon. So in 2009 in Pedicon, along with the help of American Academy of Pediatrics and various other organizations, they trained a large number of people, around 80 to 100 providers for became trainer of trainers. Prior to that, the NNF used to have around 20 to 100 trainers being created every year. So that is what happened in 2009. Subsequently, the Indian Academy of Pediatrics approached the government of India, saying that they have a large number of people and they can help in training government, doctors across India. So, and since it was just a minute, just some noise.
So meanwhile, Dr. I will mention that NRP also trains government sector and private sector also.
Sorry for the noise. Now what happened is because so they approached the government of India, and in I think September 2009, the then Central Health Minister of India, Mr. Ghulam Nabi Azad, launched the program which is called as the Navjat Shishu Suraksha Karyagram, which is similar to the Helping Babies Breathe program plus Essential Newborn Care. So what is called as currently it is I think it's referred to as Saving Newborn Lives. So something which is similar to that template. Now that that program, or NSSK, was, as it was referred to in the government sector, is duplicated in the private sector as Basic Newborn Care and Resuscitation Program, BNCRP. So after that, the Indian Academy of Pediatrics had basically two programs. One, the Basic Neonatal Resuscitation Program, where it trained the providers, anyone who works in the delivery room area, up till positive pressure ventilation, and the advanced provider course, where it trained people, doctors and nurses, etc., up till intubation and medications, and the entire resuscitation training program. Since 2009, the Indian Academy of Pediatrics has received funding from various corporate organizations, etc., for ensuring that these trainings happen. Now we are now almost in the 13th year of the training program, or the neonatal resuscitation program. Initially in 2009 and 2010, IAP, the Indian Academy of Pediatrics, and the National Neonatology Forum did not work together. But 2011 onwards, they had a proper MOU, and they worked with each other. So they had a model of that everyone could do their own trainings, and they could do trainings jointly together. It was more a kind of a association, or a model where they decided to work with each other. And so that has been going on since 2011 or so. Now I can read you figures. What happened is, because of this collaboration model and trainings, every year two things started happening. There were training of trainers for the basic newborn care training program, what were called, and what were called as district TOTs. So the Indian Academy of Pediatrics held training programs across various states to create trainers in various states for basic newborn resuscitation. It was initially a two-day program, and it was similar to the Helping Babies Survive program of the AAP. And they gave the option to members to have either the two-day program or the one-day program of only the basic newborn care, basic resuscitation, which is similar to the Helping Babies Breathe program. Over a period of time, what happened is, for whatever reason, instead of having the two-day program, most of the resuscitation trainings became basic newborn care, basic newborn resuscitation, basic resuscitation, so one-day program. Apart from this, the Indian Academy of Pediatrics holds regular training of trainers for advanced providers every year during its annual meeting, which is the Pedicon, which usually happens in January. So the number of trainers that are created for advanced neonatal resuscitation vary roughly from 60 to 80 to 100 every year. So we had two. These are called as regional TOTs, and we had regional TOTs almost one every year since 2009. And in 2009, there were 120 people who were made advanced providers. And over that last 12 years, up till 2019, we have created around 1,000 providers who are 1,000 trainers who can conduct the advanced provider courses.
So
Compared to that, the district TOTs are where trainers were created for the basic neonatal resuscitation program. We have created around 3,500 participants, 3,800 of numbers for the trainers for the basic resuscitation, but who were then what do you say? Let's say who then went and trained district providers. So that's how the training programs went.
sure.
Now,
Sorry.
sorry.
This you can see the screen.
Yeah, I can see the screen.
So this one you can. So it says that that you provided. So it started with 600 people in 2009. All the way went to significantly. Where is this? Up to we have up around 27,000, which is very high on 2014. With the pandemic, it went down. So one more point I'm here. For three organizations, IAP, NNF, and other organizations working, even the program started in 2006, it took almost 5-6 years to work together. So the reason I wanted to mention is because we have a one issue with we're bringing all the associations together. So this is a big challenge we have, and I also explained to the ILCOR leadership, it's because our culture, it's not easy to work. It takes time. We wanted to tell the importance. So sorry, sir, go ahead. I just want to take that point, and before I forget.
Yeah, so in 2016 and 17, there were some issues with some programs, and there was a kind of the program suffered from 2016 to 2018, and then it picked up in 2019 also, and then in 2020 we had the pandemic.
Okay.
Because
go ahead, sir.
yeah, so because we had these issues in the last few years, And this year, there was a kind of a renewed push for NRP. So beginning of end of 2020, November, December 2020, and the beginning of this year, we have worked on a few things. One is the government has revised the NSSK program, or the Navjat Shishu Suraksha program, or the basic NRP program, to make it more relevant based upon the updates that have happened in 2010 and 2015 and again in 2020. So they have changed the module significantly, but there was no training platform for the government employees or the government sector, and the government did not have a plan for training members in the public sector. So the Indian Academy of Pediatrics took it upon themselves to kind of create a training package. And so what we have done is, in February, we released the online basic neonatal resuscitation program for which included videos that are shown as a process of the basic NRP. So now what happens is, everyone who wants to do a basic neonatal resuscitation program logs in through a mobile browser onto the net, looks at all the videos that are there for basic neonatal resuscitation program, answers a set of questions.
Let me
And
go for
yeah.
the let me go through the website, then we'll come to the courses. So what you're saying, sir, is like I am here in USA, and we have mainly the blended courses. For example, NRP, I went to my own town, and they all go online, watch their videos, then they get past the exam test, then they come to the local trainer instructor, where we have pediatric nurse instructor, 3 or 4 hours, then they get certificate. So you are moving into that direction in the future.
Yes, so we are already in that direction for basic NRP.
Okay, excellent.
So
There's a question about training, the instruction. That's why I'm just want to clarify. So you're already online. So how what I learned from it, even the small villages now they have app. They're watching the movie. So I have found students, the medical student nurses are ready to go on the app and learn. Even young doctors, but older one we may have to still work with some kind of books, etc. And how about challenges? India is 20 states, different language. Do you think we need different languages for nurses to develop too, sir?
So what happened is, in the first language was actually Hindi, because we wanted to do some training programs in Madhya Pradesh, and then we had the English version later on in April, because of which we were able to expand in many of the southern states. Now the videos and the script, etc., is open access, and we have tried to get in touch with members from across the state, and we are ready to help them.
So no problem.
uh,
So
to
we have the plan. The ELCOR wants the application. The European Resistance wanted. We are doing this one. We have plans to move on. That's good. So do you want me to mention anything here? It is NR project is here. Anatomy committee. We have a lot of members. I'm sure they're all the members of all the presidents, and reflects the across the country. And there is state academic coordinator. We have almost every state, majority of the states are group of states are involved. So it is a geographically, it's well methodically done for the last 15 years. Then we have here courses, type of courses. We have advanced courses, which basic nurses, and of course we have the frequently asked questions here in the website. And I already sending that website to them, so the European Resuscitation Council members can go through, because I'm going past the instructor corner. It's very well done. And parent section, it's involved to resources. Is anything here, and you have videos to learn, presentations, anything you want us to show, or just this good? So
Yeah, so this is good. So what I wanted to share is, because we have been running this program for 12, 13 years, and a lot of instructors have become like not updated themselves, etc. So now what happens is, anyone who does not do the online training course and the basic module will also cease to be instructor. Even if he is an instructor, if he has not done it, will cease to be instructor. We are also planning to do, like I said earlier, we are doing training of trainers for advanced resuscitation courses, almost 80 to 100 per year. But this year we are planning to create at least around 350 in the space of 5 months, starting October. till around March.
Sure, I will.
So,
We have the data in Nature comparing with USA, EU, India, see where the gaps will land in the process. So we're open to the learning and see where we can improve them. Okay, so this is I will refer the European Union about the websites are also is um, what we saw the training wise, what my observation when you're going to the I think I mentioned the USA has around 100,000 being certified every year, 200,000 per year or something like that for 2.5 million babies, the healthcare providers. So in government sections, sir, because half of the babies are, how much percentage born in the government hospitals and versus a private?
Varies from state to state. It like usually between 40 to 60. In some states, it is 60% in the private sector. In other states, it will be 60% in the government sector. It varies. So I wanted to bring that point out to you. When in 2009 or 2010, when IAP began, because government does not have such a big, they were not able to move quickly to train a lot of people. So Indian Academy of Pediatrics helped the government of India in training, creating master trainers in each state through the basic NRP TOT. So they train the government sector doctors or the trainees in each state, and those people who got trained through the Indian Academy of Pediatrics trainers went and trained other people in the government sector. Actually, if you look at what has happened in the government, most of the government has got trained from Indian Academy of Pediatrics in 2009, 2010. Subsequently, government has had various other programs. They have what is called as a skill lab program and so many others minor programs, during which also a lot of trainings have happened. So if you look at the government sector employees also, many of them have got trained over a period of time. They have what is called as the FBNC or for newborn care, which is there in many models. So that also contains a resuscitation component, which also has got updated recently.
Okay.
Facility-based newborn care. Yeah, go ahead.
So, because the to Western government section and because average 50 to 60% of them are trained by trained masters, they will go and train. There is no certification, sir. There is no given certification, NRP certified. Here in USA, they are EU, I'm sure they get certified. But we're not certification is what are the challenges why we're not able to do that?
So we are giving certificates to the providers, and the certificate lasts for around 3 years. And after 3 years, they have to redo the course. But we are not certifying maternity homes, if that is what the question you're asking.
That's
So
right.
the maternity home. So I think there is no legal requirement as of now, and hence there is no one insists on having a trained provider at every delivery. While gynecologists and obstetricians in the private sector would try and ensure a pediatrician or somebody who's trained in NRP is present, but it is not a kind of a mandatory thing across the country.
Okay, so 40% of the babies born in private nursing homes, which is hospitals in America, they have one hospital for the whole town. There we have 10 different things. So I talked to pediatric OBGYN, so they really love to have a product there, so that they're happy if they can be trained. So those are the challenges. Do you see any other challenges, sir? What you see? I know you visit the USA frequently to many academic meetings. So compared to there, what are the challenges? What is the things in the vision wise? What is the things we can look into once we're part we can able to apply ILCOR, what ILCOR participation bring to the India in your way, in your thinking?
So what is happening now, because in preparation for the ILCOR what do you say meetings, IAP and NF have decided to work together and are creating a group of scholars around maybe 20-25 who will work on evidence that will keep on appearing over the next 5 years. And we expect that when the new ILCOR guidelines come out in 2025, and if we are a part of it, we will be able to have our own independent book as well as independent guidelines that we will be able to publish. That's the hope for 2025.
So the ILCOR only, I talked to them, they said they produce science and treatment. So the AHA or European Union bring their own guidelines on the basis of ILCOR suggestions. So how being the part of that will help immensely India being the once we what I'm trying to say, sir, is NRP or IAP or Indian Resuscitation Council Federation being involved, being ILCO, they were part of it, does the credibility of the association goes up, and the perception of the corporate sector, private sector, and of 40%, almost 10 million babies here will go up, and the certification has value, and that way it is saving more babies.
Yes. So I think it's very important, because if you look at the ILCOR guidelines that have changed in 2010 and 2015, two major changes had happened in the ILCOR guidelines for the newborn part. One was in 2010, room air became kind of the norm for term babies for resuscitation. And 2015, meconium aspiration suction, which was previously being carried out, got taken out. Now, both this, many of this in 2015, actually. The entire change happened because of research carried out in India, as far as meconium aspiration was conducted. And in 2010, when the option thing came out, at least part of the research was done in India in the early 1990s, 1992, 93 in Delhi, and in Mumbai in 1995. So India has definitely contributed to change in the science, because, as far as the newborn science goes for ILCOR guidelines. And it is not really, it is very unfortunate that India is not part of the ILCOR committees so far. And so if India becomes part of it, I think it will definitely not only improve the quality of guidelines that are created in India, but probably also it will help improve ILCOR's understanding of what happens in a country where the majority of the newborn births take place.
Right, so not ILCOR vision also, what I heard is that's why they brought to the whole world. So and now 40% of the population or 50% are under similar situation, like poor people like Africa, Middle East, and so where underdeveloped is where the challenge. So people, and obviously the acceptance of the OBGYN in private sector, 44 million people, with ILCOR being there, that will give more reassurance, because they need to accept us. They need to be band-aid certificate. So if you go and because government is already involved, if you ask the governments, can you make this certification is mandatory for the private hospitals, so that will be easier for us, right, sir?
Yeah, so NABH is a accrediting agency for hospitals, and NABH actually insists that nurses are trained in newborn care or in pediatric resuscitation, etc. So because ours, I work in a government, in a private medical college, and which is NABH accredited. We get requests every 3 years that make sure that our nurses are trained for pediatric life support as well as newborn life support. But it is not a mandatory thing across the country. And most states are trying to achieve, at least in the private sector. So there is a move towards ensuring that people are trained in newborn care, but it's not like it's probably just 15-20% of the hospitals across India, not more than that.
Okay, 80% private hospital need to be certified. Then we get more care and more education together. Sir, anything else you wanted to say? Because I think I went through all. The reason I wanted is if the record, because now the time zones, if they go, they European Union members, council members, or the neonatologists can listen to you, pediatricians. So if they have any questions, then our main meeting, we will ask them. So that way they will have other thing they can, we'll ask them to main. Even thing.
So, yeah, so I was talking about research that has happened. Even if you look at the 2020 guidelines, we had I was part of a study that was conducted at my institute, which is kind of cited in the 2020 guidelines for education in neonatal resuscitation. And the 2015 guidelines had one of my other papers on neonatal hypothermia cited in the guidelines. So apart from so quite a few research that happens in India is cited in the guidelines. And I think having more interaction will allow more research opportunities and funding to come to India, and for creation of more research. In this year itself, in 2021, there have been a slew of papers from India, which are systematic review and meta-analysis, which had looked at network analysis in neonatal hypothermia, as well as therapeutic hypothermia, which have come out and which will change the practice significantly. So I think we are in the right direction as we become part of ILCOR, and that will improve. One is in our research. What do you say? There will be more focused research which will happen towards development of guidelines, and this will help improve care for babies across India. So just to give a brief, we in the last month we have had at least 15 TOTs, training of trainers for basic newborn resuscitation, in which we have trained roughly around 600 people in October. We will have another 10 in November. Next week, there's a TOT for advanced provider course in Bangalore and in Guwahati. Not next week in Bangalore, and the week after that in Guwahati. And in November, we expect 2 more TOTs to happen for advanced provider course. So as I mentioned, and we will also be going the online route for advanced provider course and in December or so. So that will also become a part. So everything will become
So,
online.
I
Currently,
think goal should be
yeah.
a lot more than that. I think we'll work with your help and everything. We'll see. So hundreds of thousands need to be. There have to be 90% of America, and I'm not sure you. I have to find out the trainers, instructors are nurses or EMT. But anyhow, sir, I'm thank Dr. Taneja came. Dr. Taneja is IAPNRPFGM, sir. You want to say anything? Thanks for coming, and see, sir, can you say a few words?
Yeah. Good morning here. Thank you for allowing me to be over here. Dr. Somsekhar has rightly pointed out whatever was the contribution of NRP, IAP, NRP, FPM in the NRP courses, and I think we are moving in the right direction. We in the IAP ALS do not have such a organized kind of a approach towards conducting of the courses because we don't have any funding. We go as per the demand, as per the requirement of the students and the institutions who call us to conduct the courses for their delegates. And we charge them and we conduct the programs. That is how we are different from the IAP and RP, FGM. These are very sponsored courses. They get funding from the industry. Sorry.
We'll go more detail into them with yourself and
Right.
Dr. Look, you did a lot of work, so we'll do separate meeting with that. But if you want to conclude here, then we'll do, sir.
That's okay. We can come back with.
Yeah, because that way, because the website, everything detail will present the pediatric PLs, instructions, guidelines, so we can able to do that. Anything else, sir?
Right.
That close the meeting. It's already half an hour, so I'm sure sometimes people may not able to, even though we can talk. Thank you so much, sir. I really appreciate it. And we actually have confirmation. I will get a cardiologist and even one of the emergency association coming forward to join IRCF, so that will work with them.
Thank you very much.
I appreciate it.
Thanks a lot. Yeah. Bye. Namaste.
Dr. Somsekhar.
Yeah.